My name's Dr. Carl Supal, but people call me Dr. Carl. Sedation dentistry allows us to focus on doing an excellent job as opposed to worrying about the comfort of our patient. Because dentists are people too. We don't want people to be scared, and you can sense it. I mean, you can tell a human to human interaction. It's not just about talking. You can feel if somebody is anxious in your chair. And if you're not sedated and we're worried about doing even basic dentistry can be complicated. Nothing in dentistry is really easy, even basic stuff. And so there's already enough to worry about when it comes to doing the dentistry, let alone if we have that in the back of our minds that our patient's not comfortable. Because like I said, we care, and it'll always be in the back of our mind no matter what if we think our patient's uncomfortable. And so we definitely want to use sedation so that we can make our patients totally comfortable so that we can focus on doing an excellent job. Because I always joke, this is a kind of a Midwest phrase here. Dentistry is hard enough to do once. We definitely don't want to do it twice. And so I will tell you that leads to anything in life, not just dentistry. And so what IV sedation does is it allows us to do it right the first time while keeping our patients comfortable so that we can focus on getting the job done. IV sedation in conjunction with CAD/CAM dentistry is really where the magic happens. So not only are you able to sedate someone, or we're able to sedate someone, and they can be totally comfortable for 4 or 5 hours at a time, but also using some of the new tools that we have at our disposal, like CAD/CAM dentistry, where we can actually make your crowns same day in the office with sedation, is a game changer. And so I have had people come in that need 6 or 7 crowns, need a couple fillings, they might need an extraction, they might need an implant, and with IV sedation, they're totally asleep. They're totally comfortable. They don't have to worry about keeping their jaw open, getting tired. They can just be asleep while we do everything we need to do, and then when they wake up, it's done. And so, especially in Silicon Valley, a lot of my patients and our patients are busy. They're starting a new company, or they're the CEO of a company, or they're, the owner of a sports team, and their time is very valuable. And going back and forth from the office just means more time away from whatever they need to do in their daily life. And so it's just a huge, huge thing to be able to offer for our patients because of that. They can come in at 7 a.m. I can get the IV in, I can put them right to sleep, and then they can wake up by noon and be ready to go. Their driver can pick them up, they can go home, eat lunch, and after a few hours, wouldn't suggest driving, but they can get back to work, at their desk and take calls right away.